Hello, my name is Dr. Carline Dimond and I'm the Director of Public Health for Torbay Council. I know a lot of you will be worried about the rise in numbers with COVID we're seeing in Torbay at the moment, and maybe you're wondering why this is happening. You may also be worried about the NHS and what's going to happen over winter, and hearing about people possibly with long COVID, which is longer term illness due to COVID. Now, my team and I are working on this, and we've been looking at the cases as they come through and at the outbreaks and using this data to work out what's happening. This data tells us that most of these cases are transmitted or passed on socially and within households in Torbay. That's the case in all 3 towns. We've also recently asked a regional body with some expertise in this area to check this out for us. They're called the Field Epidemiology Service and are part of Public Health England. They did a lot of further analysis using their own data and came to the same conclusion, i.e. it's mainly within households and social contacts that are behind the rising numbers. So basically, that's you and me. It's also generally in working age adults in their 30s, 40s and 50s. Now, we can do something about this. We've got a unique time now. We're under partial lockdown and it's an opportunity to really get on top of these numbers. So I've said this before, but there are 3 things that are vital. Firstly, we must not be tempted to mix between households. We mustn't break those bubbles. Secondly, we must maintain space when we're out and about, especially if we're likely to be near to someone for more than about 15 minutes. And thirdly, we must self-isolate if we have symptoms or we're a contact. Now, if we can do these 3 things together, and we can all try really hard, maybe we can bring those numbers down. So let's all try and see what happens in the next few weeks. Thanks very much for listening.